Okay. All right, it says it's recording, so I'm going to go ahead and talk about a few issues that came up in other Zoom sessions that I really hadn't covered properly in the online materials. So if I didn't cover these well enough for you to really understand them, I apologize, and I'm going to use this video to give people a bit of a review of that before the quiz. So the first thing I realize I did not mention at all, although I don't think I put it in the quiz, so I think that's all right. By the way, if any instructor quizzes you on something that they didn't lecture on or didn't provide the information, you have grounds for complaint. And if you think the instructor is reasonable, email them or contact them and say, you know, this thing you asked us about wasn't on the quiz. And I mention this because I'm developing this course as I'm going. And so it's entirely possible that some future quiz will cover a matter I did not cover in the materials. And I really want to, I want to know about that, because if I do that, it will be an accident and it won't be fair. And I would want to fix it by changing grades or doing whatever is appropriate. All right, so with that embarrassing warning out of the way, the first thing is, one of the things utilitarianism relies on is diminishing returns of utility, diminishing returns of money. And the way this works is when you're a kid and you have pocket money, you have an allowance, $100 would be a really big amount of money to get. It would be a red letter day if you got $100 extra in your pocket, unless you guys already get $1,000 allowances. I'm assuming $100 would be big. It would have been big for me. But, you know, when you're working, it's okay, it's nice. But you know, you already make a few $1,000s a month, and well, maybe not that much, but you already make quite a decent money. So $100 is nice. But when you're in your career and you're a professional engineer, you're making thousands of dollars a month, and $100 is not that a big deal. And if you come up with a really good invention and develop a patentable idea that is really important, and the money starts really rolling in, so you're getting thousands of dollars a week or even thousands of dollars a day, $100, it's like, yeah, put it on the pile. It'll be nothing to you. And that's diminishing utility of money, that the amount of effect a given quantity of money will have on someone's life depends on their situation. So spending money helping the homeless produces much, much more money than spending money making the lives of billionaires just slightly more pleasant. In fact, they probably won't even notice. So this is why one of the reasons utilitarianism fundamentally believes in redistributive taxation, that from the point of view of utilitarianism, a society should have the kind of tax structure that most European countries have, or which America had in the 1950s. And if you have someone talking about how prosperous we were in the 1950s, you should also remember that the top tax rate was something like 90%. There were people who earned so much money that the government would take 90% of it, and they were just okay. They were not made poor by this. They had great lives. So when money's taken away from the rich and used to improve the lives of the poor, then that utilitarianism says, yay, great. Right. Other moral theories maybe not so happy with it, but utilitarianism thinks it's wonderful. The other thing about this from the utilitarian point of view is that if you spend tax money on things like public health programs or a single-payer universal healthcare system, such as they have or used to have in European countries, that saves money too, and it has high utility. And the reason it saves money is because someone has a disease or has some worry about their health, and they go to see the doctor right away, they can be screened, and the disease, whatever disease they might have, will be caught early and treated easily. Right? If you think of a disease, I can't think of a disease, but like cancer. Right? You ever see in the TV they say you've got cancer, but we think we've caught it in time. Right? And so sometimes weeks, a matter of weeks delay can really cost someone. But if you get the diseases when they're small, and you get people health device, you have anti-smoking programs and tax or other disincentives to make people stop smoking, that saves an enormous amount of money. It saves a lot of public money because emergency departments no longer have to treat so many people who are in such dire straits. And it saves individuals money, or health plans, or insurance companies and employers money, because people are less sick and people don't have catastrophic medical costs later in their lives. So from the point of view of utilitarianism, you should have a strongly progressive tax system and sensible public services programs to improve the general welfare. Because what the value of money depends on how you spend it and the effect. Right? Because the value of money from the point of utilitarianism is the effect it has on people's lives. Okay, is that a clear idea, that something that you can at least understand well enough to work with and figure out? All right, good. All right. So it had also turned out that I completely failed to explain the difference between an instrumental and an intrinsic value. Right. So the difference between an intrinsic and an instrumental value. Have you got anything in your house that you have just because you want that particular thing there? Like, you've got this piece of art or an interesting rock or a piece of clothing that you just really like to wear. Right? That is something that if you lost it or it was destroyed, you'd replace it. Right? Something that you want. Or an activity that you like doing, that you would just go out of your way to do. Right? And when it's done, you say, yes, good, that's it, that's what I wanted to do. Or the object, you put it on the shelf and you say, right, that's it, I'm finished, I've achieved my goal. Those objects and activities have what we call intrinsic value. The value is well, that didn't work. The value of them comes from just the possession of it, the existence of it. Now, have you got anything around your house that in itself is not particularly valuable, but it's something you can use to get something valuable? Like flour, a bag of flour. I am not going to sit down ever. Nobody is ever going to sit down and get a bag of flour and just spoon it out the bag. And you see a bag of flour on your shelf, you say, well, I've got flour. Right? And you might have a bag of flour in a shelf for years and just like, oh, forget it. That doesn't have intrinsic value, but it might have instrumental value if you like cake or bread or things. I got the flour to make my bread. The bread is the thing you want. The flour is a means to getting it. So that's instrumental value. Would anyone like to take a guess at the thing that's most commonly used for its instrumental value? and almost never has any kind of instrumental value, of intrinsic value. It's not intrinsic, it's pretty much there to have instrumental value. Something you get so that it'll help you get other things.
Money?
Yes, money. That's exactly it. That's what I was fishing for. All right. So is that sort of clear? Means to an end. There's a sort of rather nasty example of this. Have you heard of somebody dating one person, not because they like that person, but because they like their friend? If you ever saw Shaun of the Dead, there's a character who dates the best friend of the heroine because she was after the heroine. Played by Dylan Moran. All right, so a couple things came up that I wasn't expecting. One thing that came up was somebody started talking about societal value or social value, and I got a series of questions like, but isn't it a fact that sometimes what society values is the wrong thing or is bad for people? And my answer is sort of, yeah, and where are you going with this? So I want to emphasize utilitarianism is not about what society values. It's not about what any particular group of people value. It's about what is actually valued, actually valuable. For instance, nutritional supplements, huge industry, makes billions of dollars every year. Very, very politically powerful. Also completely unregulated, and unless you found a brand you can trust that provably has the right things, you're not even well. Some supplements are good things to have. Other supplements are things you don't need. Some supplements can be actually dangerous. Many supplements don't actually contain the substance listed on the label. You might get a little vial and it says valerian, but there's actually no valerian in it. And about 43 people a year die from taking badly prepared supplements. So don't ever take an off-brand supplement. Use a major brand if you're going to take supplements, because the cheap ones can kill you. Now, utilitarianism looks at that, and you can see this is something that's very valued by society. There's lots of things that are really valued by society that are actually not at all valuable. And things that are valuable that are actually not valued by society, like vaccinations. There are a lot of people who hysterically hate vaccination. But the evidence is, and the utilitarians will tend to go to science for answers. The evidence is vaccinations are good for you. They prevent diseases, some very horrible diseases. And until the anti-vax movement got going, a number of diseases were being virtually eliminated. They were on the edge of eliminating, but now they're making a comeback because people are not vaccinating. So it's very important to remember that utilitarianism is about what is really provably valuable. It can sometimes really be hard to tell what's valuable and what isn't, but you can do the calculations. That there are experts who can understand this stuff. You can review the research and so on. So, real difference between being valued by society and being actually valuable. Right. Now, something I know I haven't explained as clearly as I could, and when we get to the general discussion phase, I think I'm going to want to come back to this to see what you guys think. But there is a difference, a real life difference between satisfaction and immediate pleasure, or long-term pleasure and momentary pleasure. And this difference is relevant to utilitarianism, and it's relevant to the weakness in utilitarianism, because the way I set up the reading, you get an explanation of utilitarianism, then a number of really not very good or even silly objections to utilitarianism, and then it sort of slides into the hospital example, and where you start to see utilitarianism saying things like, this guy, we should cut this guy up, we should kill this guy and take his organs and give them to other people, and that will maximize utility. And we tend to look at that and say, no, we shouldn't. It's horrible that 5 people are going to die, and it may be true that we could save them by killing a random person and taking their organs, but still we shouldn't do it. And that's going to get some more analysis later, and I'll want to see what you guys think about it. But I want to step back to talk about utility and liberty, because that satisfaction thing comes in there. Now, one thing to understand about utility and liberty is that utilitarians, particularly John Stuart Mill, are really big on liberty. They like liberty, but for instrumental reasons. John Stuart Mill did not think that liberty was a value in itself. He thought that it was an important way of maximizing utility. And give me a second, I've got to let the dog out. I'm sorry. Excuse me. We have a golden retriever who, yeah, is still standing there. I think this is actually a cat. Oh, there she goes. All right, so that's where the difference between an intrinsic and an instrumental value is really important, because utilitarianism thinks that liberty is like money, that it's something that's good to have because you can get all kinds of other things with it. And John Stuart Mill was very, very adamant about liberty. He was a strong defender of liberty because he thought it led to very, very, very good things. Remember the thing about utilitarianism being a kind of consequentialism? It's all about the consequences. Well, utilitarians value liberty because it has a lot of good consequences. But the thing is, if depriving you of your liberty would make the whole world a lot better off, utilitarians would sell you down the river in a second. That's their attitude towards liberty. They don't think it's a real value. Now, next week, we talk about rights theory, in which liberty is a real value. Rights theorists think that liberty is like love. It's a really good thing to have in itself, and it's not good to not have it. Right? If you don't have it, you're less than okay. You know, you can deal with it. People can deal with being in prison. People can deal with not having anyone in their lives, but it's really a lack. Whereas for utilitarianism, you don't have liberty. Okay, well, are you otherwise badly off? Then what are you complaining about? It's a sort of, and that ties into why utilitarianism turns out not to be the perfect moral theory. That there's obviously something there. And here's an example of utilitarianism actually restricting liberty in a way that we might support. You know that back in the late 20th century, actually in the middle 20th century, when transplant surgery was really beginning to hit its stride, waiting lists for organs, transplantable organs, were fairly short. If you needed an organ transplant, you might have to wait at most a couple of months. Pretty much everybody would get an organ within weeks. And then something happened, right? Something happened, and the supply of transplantable organs went down. People were still filling out donor cards, right? The laws for transplanting and consent, and nothing really happened there. But something happened in the rest of society that was not expected to have a deleterious effect, but the waiting lists for the waiting time for getting organs ballooned because the supply of transplantable organs nosedived. It went down. It was reduced by an order of magnitude. So what happened in the late 20th century that drastically reduced the supply of human organs, viable human organs for transplant? Someone want to take a wild guess?
Would it have something to do with the AIDS epidemic?
Something to do with what?
The AIDS?
It wasn't AIDS, but that's actually a really good thing. It's something that's kind of ironic. Also, it's distantly related to the movie Easy Rider. Last class, somebody guessed airbags and seatbelts, and that was a really good guess because that's on track. What actually happened was helmet laws. The government made it illegal to ride a motorcycle without a helmet. And how did this affect the supply of transplantable organs? Well, the main source of transplantable organs before this law was young men who ride motorcycles really fast without helmets. So these guys stopped dying in such numbers because if there was an accident, they'd come off the motorcycle and they'd hit their heads against the road or another vehicle or something. And because they weren't wearing a helmet, it would kill them. But the rest of the body would be fine. Oh yeah, let's get him in, they'd cut him up. You know, they'd arrive in the emergency department. The doctors would make heroic efforts to try to save their lives, but they would die anyway because many of them would die anyway because of massive traumatic head injury. And then they're right there in the hospital. So, you know, why not? We can cut them up. They signed the donor card, or we ask their parents. And so I'm not saying that utilitarians would view helmet laws as a bad idea. However, the reason they view it as a bad idea, they don't view it as a bad idea is mainly because helmet laws also save tax dollars, because a lot of these guys did not have health insurance, and the emergency departments would spend their own money and then they'd bill the government, and so it would come out of tax dollars. So from the government point of view, helmet laws were a great idea because they saved the government a lot of money. Also, they saved lives. A lot of people care about that too. But and utilitarians care about that. Although from a utilitarian point of view, a guy kills himself accidentally and then 5 other people live because of his organs, we're actually ahead of the game in far as utilitarianism is concerned. In utilitarianism, it's like, well, yeah, it's really tragic that this young man died at this age, but you got to look on the bright side. 5 other people will survive who would have died. So on the whole, it's actually better for overall utility, right? And if you listen to me say that and go, oh, God, no, that's awful, that's just wrong, then you're not a full utilitarian. Okay, so any questions about any of that before I stop recording? And we'll go to sort of general discussion. Okay, so thank you very much for sitting through